I am going to discuss erectile dysfunction, or commonly known as impotence, following prostate cancer treatments, and as well as treatment options available to patients. Impotence is a common side effect of many prostate cancer treatments. Treatments for impotence include a wide variety, from a minimally invasive standpoint, which usually starts out, of course, with medical therapies, which include oral therapies or medications, and range from injection therapies, intraurethral suppositories, and also include penile pumps, as well as the last option would be a penile prosthesis. And I will discuss each of these in particular detail. Particularly starting with oral phosphodiesterase inhibitors, which the three most common medications include Viagra, Levitra, and Cialis, have been commonly used, and many men are quite familiar with utilizing these agents for treatment of erectile dysfunction unrelated to prostate cancer treatments. Quite often, many patients do come to my office requesting some form of what's been talked about as penile rehabilitation therapy. And what that entails is essentially restarting the engines, if you will, in regards for erections itself. This includes the combination of these medications, the oral phosphodiesterase inhibitors, or what's also, if the impotence does not improve, include moving on to the next stage of treatments, which do include injection therapy. This is intracavernosal injection therapy, and the needle is injected into the base of the penis itself to essentially stimulate an erection itself. If this, in fact, those two combination treatments do not tend to work in regards for the patient having successful erection for intercourse, the other option is an intraurethral suppository, or a prostadil. It's a pellet that's inserted into the urethra itself to cause an erection. Both the injections as well as the intraurethral suppository, however, should be done at the discretion of the patient's urologist in the office due to the side effects that may be present with these, which include a decreased blood pressure, in addition a meticulous review of the medical history and medications to deem that any of these therapies are safe. The next option, depending upon a patient's preference in response to the prior treatments, would include a penile pump, which can include a device that's inserted onto the penis itself to bring in blood flow, and a ring is inserted at the base of the penis. The last option would include penile prosthesis, which come in a variety of components, which include both malleable, which essentially the patient moves the penis up and down, him or herself. And in addition would include a penile pump, which has a three-piece component or a two-piece component. Depending upon the patient's preference and the counseling, this would be the last more definitive option in regards for treatment for impotence itself. There's a greater than 90% success rate with the surgery itself, but I think the most important factor is to have a patient talk with their urologist in regards to the most appropriate treatment for their impotence.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways. The test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.